It is just a huge honor for me today to be podcast interviewing Dr. Harvey S. Shiffman, DDS, who is a general practice at the Laser Dental Center in Boynton Beach, Florida. He's a graduate of Georgetown University School of Dentistry and completed a general practice residency at Georgetown University Medical Center with an emphasis on treating medically compromised patients. Dr. Shiffman completed certification with the Academy of Laser Dentistry in 3 types of laser systems and was recently awarded a fellowship in the ALD. He is personally involved in the use and development of cutting-edge technology and has performed tens of thousands of laser dental procedures over the last 18 years. Dr. Shiffman is an instructor for the Academy of Clinical Technology. He's most recently lectured at the Rocky Mountain Dental Conference, Seattle Study Club Symposium, Yankee Dental Congress, American Sleep and Breathing Academy, the Greater New York Dental Meetings on Advances in Laser Dentistry, and the 2018 Laser and Health Conference in Slovenia. Dr. Shiffman is an adjunct professor in the Department of Prosthodontics at Nova Southeastern College of Dental Medicine, and most recently was awarded the expert lecturer status from the Laser and Health Academy. Hey, thank you so much for coming on the show today. How are you doing?
I'm doing great. Thank you for the invitation.
So be honest, when you lectured in Slovenia, did you think at least twice that you weren't ever going to leave and come home back to Florida?
No, Slovenia is a beautiful country. You know, it's wedged in between Italy and Croatia, and it's a beautiful, beautiful country.
Oh, I know. I love it. I remember when I lectured at Venice, I took my oldest son, Eric, and we actually rented a car and drove all around there in Croatia and lectured in Albania. And what all I couldn't keep thinking of is that when you look at the Adriatic Sea, on the one side is Italy, and all that land on the ocean is like $1 million an acre. And then you cross, and it's like $10,000 an acre. And I thought to myself, my gosh, Eric, we should stay here and buy up all this land on the beach. And then when you're my age, it'll all be $1 million an acre condos and resorts. That's any dentist listening to this in Europe, man. Go to Albania, go to Slovenia. Croatia is just amazing. But so I'm going to hit you with the hardest question. This is Dentistry Uncensored. We don't pull any punches. She just graduated from dental school. $400,000 in debt. I mean, you're there in Nova. That's $100,000 a year. I'm here in Phoenix, Midwestern in Glendale's $100,000 a year. ATCL's $100,000 a year. So she walks out of school, $400,000 in debt, and she says, "My God, if I buy a laser, that's another $100,000. If I buy a CBCT, that's another $100. If I buy a CAD CAM, that's another $100. When you're coming out of school, $400,000 in debt, can you really afford a $100,000 laser?"
Well, I mean, it depends on what you want to do with it and what kind of dentistry you want to practice. You know, if you're looking to set up a practice which is very forward-moving, progressive, then you've got to embrace laser technology of some kind these days. People that are coming into the office or searching us on the internet, they're looking for high technology, and lasers are part of it.
So do you consider, well, I have a friend who is, and I know you're thinking, Howard doesn't have any friends, but I got one. And he's a podiatrist. Yeah, foot doctor. I was getting confused with pedodontist. And he advertises laser foot surgery, and he just thinks he only bought his for marketing. He said that is the thing. People, when you tell someone they need a cortisone shot in their foot, they immediately start wincing. Just the thought, I mean, imagine your foot's sore and you're going to go to some guy who's going to stick a needle in your sore foot. But he thinks that the laser for him was 10 times more about marketing than it was even clinical podiatry. Do you see laser dentistry as more of a marketing play or an actual treatment play?
I mean, we use our lasers. We use the Photona Lightwalker laser, which has 2 laser wavelengths in it. One is for hard tissue, one for soft tissue. So we use that machine all day long on every single patient that comes into the practice. Our practice is laser focused. So is it marketing? Part of it is, because we get a lot of patients that come in, you know, seeing our YouTube videos and the videos we have on our website and everything, and they're searching out these procedures because they know there's going to be less bleeding, less discomfort, it's going to heal faster, and all these positive aspects of laser dentistry. So it's a combination of both things together for sure.
So out of all the and by the way, this is not a commercial, even though one of the biggest wigs in that company is Keith G. Bateman, and I'll never forget his name because his initials are the KGB. So every time I've seen him for the last 30 years and he asks me a question, I'm like, is this being recorded for the KGB? But anyway, that's our 30-year running joke. But of all the and this is not a commercial, Keith Bateman didn't ask me to bring you on, or I called you, you didn't call me. But of all the laser systems, why did you pick Fotana and the Lightwalker system?
Well, I mean, I've been using lasers for 18 years. So obviously, I've had a lot of experience with different companies and different, machines, different wavelengths of laser. So every time I was back in the market, I would research all the machines. I would test them, see what they could do. And for the last about 10 years, I've been a Fotona user because of the strength of the company, the machine, what it can do. I mean, it can really do more than any other laser that's on the market, conservatively speaking. Okay. Well, so that's my choice.
25% of my viewers are still in dental kindergarten school, like over at Nova. You said it's a hard tissue and a soft tissue. Go into more detail on that. What is a laser that only does soft tissue versus a laser that does hard tissue and soft tissue?
Okay, I mean, a soft tissue laser is typically a diode or something similar to that, where you're doing gingivectomies, gingivoplasties, treating soft tissue lesions. A hard tissue laser is going to be able to do restorative dentistry, crown preps if you want. You can cut bone with it, any kind of tooth structure with it. When you have the two combined together, you've got the best of both worlds, because you can do full osseous periodontal surgery where you're cutting and treating soft tissue and, recontouring bone and decontaminating bone at the same time. So a lot of different uses, when you have the two wavelengths together in the machine. And the only one that's got those two wavelengths is the Fotona Lightwalker.
That's the only one that has that for hard and soft?
That's got the two wavelengths in the same box, basically, is the Fotona Lightwalker, correct.
So the only dental laser that has the hard and soft tissue wavelengths in one machine is the Fotana.
That's correct. I mean, some of the other machines, you can use the wavelengths that are there to cut hard and soft tissue, but we have two dedicated separate laser wavelengths to do those procedures. And by the way, laser is an acronym standing for light amplification by stimulated emission of radiation. And the first laser was built in 1960 by Theodore H. Mayman at Hughes Research Laboratories by none other than Howard Hughes. So that's what I have the most common in with lasers, is my name's Howard. There you go.
And by the way, I got to tell you something about Howard Hughes. Remember that movie? What was the movie that he did? Was it Avatar? What was the Aviator? And I went and saw that movie, and you won't believe this happened. It wasn't even a couple of days later, a patient of mine came in, and I just mentioned that I really liked that movie on Howard Hughes' Aviator. And turns out it was a retired man born in Nogales, Arizona, who worked with Howard Hughes, and he thought that movie was the most well done. I mean, that he thought it was a historical docudrama movie. And when they were coming out with the movie, he thought they're never going to get Howard Hughes right. And he said Leonardo DiCaprio just nailed the entire movie. So lasers started in the Howard Hughes Research Laboratories in the 60s. I was born in 1960. I was born in 62. They've come a long way since you and I got out of school.
Oh, absolutely. Absolutely. Yeah. I mean, some people say to me, you must be an early adopter, but my mentors were the early adopters. The people that I learned from, back in using lasers back in the 80s and doing periodontal surgeries and all kinds of things with them, and just move forward from there.
So go into more detail. You said it has two wavelengths dedicated, one for hard, one for soft. What are those wavelengths, and how are they different?
The soft tissue wavelength is neodymium YAG, or ND YAG, and that's strictly soft tissue. We also use it for what's called photobiomodulation to help healing, stimulate cellular energy, and that type of thing. And then the erbium YAG is the other wavelength that can be used to cut soft tissue, hard tissue, tooth, bone. We use it for snoring and sleep apnea treatments, for facial rejuvenation treatment, lip plumping, all kinds of things. It's a very diverse machine.
And now talk about the hard tissue and tooth versus bone.
Well, we can with the newest machines, we can cut teeth as fast as a high-speed handpiece. We can cut bone, do tori removal, wisdom tooth extractions without using rotary instruments that can, microfracture or damage soft tissue. So very, very safe, much more gentle for the patient, less post-op pain, less post-op bleeding. You can coagulate with it. A lot of different options.
One of the most interesting podcasts. I've already podcasted 5 dentists who are no longer with us. Dennis T. Myers, Ivan Kirshner, right here in my backyard in Scottsdale, Robert Ibsen, the founder of Denmac, Carl Mesh, who needs no introduction. But one of the most interesting ones was Fred Margolis out of Chicago, who was really considered by many the pioneer of bringing lasers to pediatric dentistry. And he even said on this podcast 2 or 3 years ago before he passed on that he couldn't believe that pediatric dentists didn't use a hard tissue laser. He said, my gosh, in the time it takes you to get a child numb, he could, and have to give a shot, which is not very good and fun. He could do the whole dang procedure. But he said, again, back to marketing, the mothers, the average female Homo sapien, grade A monkey, will talk to 5 other people for every one time a man will. And it crosses all of the greater apes. And he said when those moms would see that he didn't give a shot and would do it with a laser, that she would go out and tell everyone. He just thought it was the biggest practice builder he ever had. Have you witnessed that effect?
Oh, absolutely. Our patients, because we use the laser on every single patient in one way or another, either to relax their muscles after a long procedure or to pre-numb them with the laser before we give an injection if we have to, or fillings with no injections. They go out and they tell all their friends and family, and we get a lot of our referrals come directly from our patients. So absolutely, I'm a firm believer.
Did you ever meet Fred?
I knew Fred very well through the Academy of Laser Dentistry, and he was a pioneer and a true gentleman.
Yeah, he was a class act, man. R.I.P. Fred. We're still talking about you, and it's been 3 years. Do you see where you're at? You're in Boynton Beach, Florida. Do you see pediatric dentists using this?
Not too many in our area. My area we're probably about 75% geriatric where we are in South Florida. So there's not a lot. Well, there's pedodontists around, but there are no pedodontists locally to us using lasers. That they really should. I've got a lot of colleagues, pedodontists, that are using the Photona Lightwalker laser, and their patients absolutely love it. So no shots, which is huge. No drill sound and no shot, the thing that people fear the most.
So the curse, so would you almost consider yourself a geriatric dentist then?
I guess so. Because the majority of our practice is geriatrics. Reconstructive dentistry, perio, endo, facial rejuvenation, all those types of things.
And how much does this Photona, named after Photona, so it's Photona, is pronounced?
Correct.
Photona.
Correct.
After the light photon, how much does it cost, and how many times a day would you say you use it?
Well, the machines are around $80,000. I mean, obviously, I'm not a salesperson, so I can't tell you exact numbers, but it's in that ballpark. And if we see 10 to 15 patients a day, then 10 to 15 patients have the laser used on them in some way. Whether, like I said, it's treating sore muscles after a long procedure, pre-numbing before an injection to make the injections more comfortable. We can give palatal injections after laser pre-treatment that are almost totally pain-free, which is pretty amazing. So pretty much on every single patient.
So using the soft tissue laser on the greater palatine, and numbs it up so that when you give an injection, it's less uncomfortable?
Yeah, we use it for infiltrations, for palatals, for blocks. Anywhere where you're going to give an injection, we pre-treat it with the neodymium YAG laser and then inject right into that spot. And 85 to 90% of the time, the patients feel absolutely nothing. And with no side effects from topicals. No swab.
Yeah. So start talking about the all the different things you use it for. Did it replace packing cord for you or not really?
I would say over 50% of the time it does. It just depends on the tissue. But we do troughing with it, gingivectomies, tissue recontouring for smile design. We're very big on treating snoring and sleep apnea with the laser, and facial rejuvenation. We've got a procedure called smooth laze that I actually hold the trademark on, and it's facial rejuvenation all done from inside the mouth. So we're tightening collagen, we're stimulating new collagen formation. With the snoring and sleep apnea, we're preventing the collapsibility of the airway by stimulating new collagen, in the soft palate and the uvula. And that's all done with the same laser, just, different hand pieces that are adapted to it. And like I said, we do a lot of periodontal surgeries with it. We do a procedure called PIP sweeps, which is for endodontics. And, pretty much anything you can do in dentistry, we can do with a laser. And it's more comfortable, and patients are happier when they leave.
You said PIP sweeps? PIP sweeps?
PIPS, photon-induced photoacoustic streaming. And there's a new modification of that called sweeps. And it's laser-activated irrigation in the canal system to kill bacteria, remove soft tissue in the canal system in areas where files can't even go. Pretty amazing. I saw a lecture by a gentleman by the name of Mark Colonna over 10 years ago, and that's when I bought my first Photona laser, when he was talking about the endodontic applications of it.
And so you do your regular endo, and then the very last part of your cleaning and shaping is this PIP sweep?
Well, in between each file, just like you would irrigate after each file or each succession of files, we go in with the laser and do the photon activated irrigation, and we're getting a much cleaner canal. Bacterial kill is higher. It's all proven by research. So very, very, very efficient, low cost system, as far as, any disposables or anything.
Wow. Do you think this is going to take off more with endodontists?
It already is. We've got a lot of endodontists using the Photona lasers, and more and more of them over time, because I see them in the training programs coming through. Periodontists also.
Huh. And Mark Colonna with the Montana Center for Laser Dentistry, he's doing this too, huh?
Yes, he was one of my early mentors.
Is that right? Well, you ought to tell him to come on the show and follow you. That'd be a great 1-2 punch.
Sure, I'll talk to him.
Yeah, and so the one thing when you talked about facial rejuvenation, and then earlier you said you were 70% on senior citizens geriatric. I really had my mind blown when I went to New York and spent a day or two with Larry Rosenthal, because when I was a young kid, I thought cosmetic dentistry was for like supermodels. Turns out that supermodels are already beautiful and gorgeous. And what Larry was focusing on is he realized that 80-year-old women would give you would do anything to look like they were 70 again. And my gosh, his entire practice, when he was charging all these amazing cases of cosmetic dentistry, but they were all older ladies. In fact, he said the biggest one-liner closing sell is, my gosh, I can make you look 65 again. And these 75-year-old women would start dumping out their purse. Do you see facial rejuvenation more with older women as opposed to older men?
Well, I would say probably 80% of our rejuvenation patients are female and 20% are male. And, when we first started doing it years ago, it was 100% female, but that's starting to shift because we can actually conservatively turn the clock back on how these patients look. Because, I've spoken to so many dentists. You do a beautiful set of anterior crowns or veneers, hand the patient the mirror, and what's the first thing they do? They either fix their hair or they look and they go, I hate this. Wrinkles, sagging lines on their face. So using the smooth laser procedure, we're able to turn the clock back a good 10, 15 years for these patients, and we can actually prevent wrinkle formation by keeping, young collagen stimulated in the patient's skin, all from inside the mouth.
So that means you're going to create a course on Dentaltown on the smooth lace procedure for me? Just say yes.
Sure. Yeah, absolutely.
Really? Would you do that?
Yeah, of course.
So talk me through it. How do you use a laser? What is the smooth lace procedure, and how does that work? What are you actually doing?
We're using the neodymium YAG laser, the soft tissue laser, to preheat the tissue, and then we follow it up with a proprietary handpiece with something called smooth mode technology. It's a burst of 6 pulses in 1.5 seconds. And what that does is it pumps heat into the tissue, creates something called a heat shock, which stimulates collagen conversion, tightening of collagen, and then stimulates the fibroblast cells to start forming new protein that's formed into new collagen. So it's we're down working on the cellular level with this stuff.
And if you did 100 senior citizens, how many of them would think it was a success and notice a difference?
100%. 100% of them. Yeah. They all need multiple treatments, and depending on the loss of elasticity of their skin, we treatment plan them based on that too. And once we get about 3/4 of the way through their treatment, they start to see the difference. They feel the difference in their face, elasticity wise. Sagging starts to tighten up, bags underneath the eyes start to tighten up. It's pretty amazing stuff, and definitely rewarding when you show the patients their before and after photos, and they can really see the changes that have happened.
So is this a one treatment, or is this a series of treatments? Is this a one?
It's a series of treatments. Yeah, smooth laser is pretty much age based. So a 50-year-old would typically need 5 treatments, 60-year-old 6 treatments, etc. And then we modify that a little bit if they've got a really significant loss of elasticity, a lot of sun damage, if they were a smoker kind of thing. So, and then preventative treatments to prevent wrinkles, usually 2 treatments. And patients in their 30s and 40s are having those done.
What I've been doing is, instead of trying to look younger, I just tell everybody I'm 10 years older. I just say, I'm 72, and they go, damn, dude, you look good. And
right.
So then is this a combination thing? Are you also a Botox dentist, or?
Well, we do offer our patients Botox and dermal fillers, and we'll use these things in combination, as necessary. The majority of my patient pool down here in Florida doesn't want to have artificial materials injected. Some of them do, and we combine the smooth laser procedure with Botox and fillers sometimes, or we used a platelet-rich fibrin and we inject that, so more natural than artificial materials. So we have options for all different patient requests.
And how much do these treatments cost?
Well, a 70-year-old is probably looking at close to $7,000.
No kid, $7,000, 70. So it'd be 7 treatments. So $7,000 would be $1,000 a treatment 7 times.
Yeah, that's the high end. Okay, so anywhere from about $4,900 up to about $7,000, depending on their skin type.
Wow, and how does someone learn something like this? You teach a 2-day course on this or something, or?
Well, I'm pretty much the developer in the United States, and I teach the training courses. And we have a 2-day program that includes the night laser, snoring, and sleep apnea reduction therapy, and the facial aesthetics is the second day of the program.
And where does someone find the dates of these events?
Through Fatona, fatona.org. On the website, there's an educational area that they can go to and find the training course schedule. Excuse me.
Okay, let me see. I think it's FOTONA.com. I don't.
.com.
Yeah, I don't.
Yeah, I think he will get you there.
You think Org will get you there?
Yeah, I think so.
Nope. Not today.
No?
Not today. So if you go to Fotona, FOTONA.com, the workshops would be there. What would be under? Events, training, and workshops. Okay, I'm finding that. And
yeah. Go into the dental section. Fatona also has dermatology and gynecology, urology lasers. Okay. So they're not just in the dental market.
Okay, which one's their best market? Aesthetics, dentistry, gynecology, or surgery? What's their best success?
It varies all over the world. I mean, if you would have asked me 5-6 years ago, it was dentistry in the United States. But now the aesthetic division is really booming in the U.S. I mean, dentistry is too, but aesthetics and dermatology are selling like crazy.
So let's just take these one by one. Let's start with night lace therapy. How it says on the website, Fotona's night lace therapy is a non-invasive, patient-friendly laser treatment for increasing the quality of a patient's sleep. How does that work? How does a laser help with sleep?
Well, night laser is a non-surgical treatment. So what we're doing is we're preventing the collapsibility of the airway. Sleep apnea, snoring is from loss of tone of tissue in the back of the throat, the base of the tongue, the anterior tonsillar pillars. So we're reestablishing new, more elastic collagen and tightening the existing collagen that's there, and we're reducing the collapsibility. And, we've proven that through research studies with various different modalities. And very, very successful procedure, and tens of thousands of cases all over the world that have been done since 2011.
And another, you and I have seen, I always say there's 9 professions, and the one that changed the most in the 31 years that I've practiced since 87 was periodontist. And my gosh, when I got out of school and I was little, it was always 4 quadrants of surgery. Then 10 years later, everybody thought, you know what, that doesn't work. You're going to treat this gum disease with forceps. And they started extracting all these molars and replacing implants. And then about 10 years after that, they started realizing that, my gosh, 40 to 60% of these implants have periimplantitis after 5 or 9 years. So what are your thoughts on using this as for periimplantitis? And there's another laser, Lenap, that talks about this too. Are you using yours for periimplantitis?
Yes, we are. The erbium laser can actually clean and detoxify the titanium surface of the implant without doing any damage to the factory surface, and you can get bone regrowth, regeneration onto the implant surface. And then we use the neodymium YAG wavelength, which is in the Millennium laser also, and we use that to detoxify the soft tissue around the implant for reduce the bacterial load and stimulate more rapid healing with that wavelength also. But the erbium is successful at cleaning the implant surface and the bone.
Well, this is Dentistry Uncensored, so I'm going to have to at least throw it at you. And what would be the difference of doing it with a Fotona laser versus the Lenap laser?
Well, with the Fotona laser has the hard tissue wavelength, so we can actually clean the surface of the implant without doing any damage, and we can clean and detoxify, decorticate the bone defect around the implant to place graft materials, biologics, membranes, whatever you'd like to put in there. So they're two totally different approaches.
A lot of people say that laser-assisted tooth whitening is gimmick, not science. Do you agree or disagree?
Well, I disagree because, we do it, when we do it with the erbium laser, very different than using a diode laser, where there are no pigments that absorb the energy in the gel, like with a diode laser. We're actually only microheating the water molecules in the gel itself on the surface, so there's no significant heat penetration into the teeth. And we do see, a better, longer-lasting whitening effect than, other products that we've used in the past. So I'm a believer.
Yeah, well, I'm a believer that when you tell someone to take these trays home and soak your teeth in it, but people want to be one and done. They could go to Walmart and buy a permanent in a box. I grew up with 5 sisters. Back then, only rich people could have it applied. You would go to the store, you'd buy a kit, and they would come home and do it in the kitchen sink. But girls today don't really want to do it in their kitchen sink. They'd rather go to a salon and have someone else do it. I think the market for having someone else bleach your teeth is bigger than a do-it-yourselfer at home, because time is money, and they just don't want to spend the time. Do you agree or disagree?
And I agree with that because, we do home trays also in the office, in our practice. And a lot of times the patients will take them home and they'll sit on the bathroom counter and they'll use them once or twice and never follow through. When they come into the office and have a whitening procedure done, it's done right there. And, there's no compliance issues once they walk out the door. So our office is probably right now about a 25-75 split, 25% in office, 75% home as far as whitening is concerned.
And you lectured in Slovenia, and on the Fotona website, they even have an address in Slovenia. Is that where the laser's made?
The factory is in Slovenia, correct? Yeah, and it's the Fotona has been in existence since the 1960s. They started out as a military. Like sighting lasers, fiber optics, and that kind of thing, and they developed from there. But the factory is there in Slovenia, and the Slovenian people are very committed to their quality product.
Wow! So it started out as military laser. That is amazing. So they so Slovenia used to be in Yugoslavia. So was that part of the USSR?
Yeah, I guess so. Yeah.
Wow. So that was their high-tech military laser, because it was the competition of the Cold War that drove so much of space, going to the moon, lasers. People, you really have to go back and realize how important competition is to get a society moving. So that was an old military technology. That is unbelievable. So when you lecture there, you obviously saw the plant and all that stuff?
Yeah, I've been in the factory, very, very secure facility. I guess there's a lot of industrial espionage that goes on, So the majority of the factory is several stores below ground level, stories down. It's kind of like a concrete bunker from the Cold War days, and very interesting. But they manufacture probably in the high 90% of the machine right there. CNC milling machines running 24 hours a day, making components. So they're pretty cool people when we go over there and meet up with them and listen to the research and development people.
That is so cool. My gosh, that is so cool. So when you lecture, and you've had some prestigious gigs. Rocky Mountain Dental Conference, Seattle Study Club, Yankee. when you're lecturing, like at the Seattle Study Club, what are you lecturing on? What do they most want to hear about?
Well, I mean, it's usually one of two things. Either it's an introductory level program that I do for people who have no knowledge of lasers whatsoever, or we talk about the sleep apnea and facial aesthetics for docs that have had some exposure to lasers and they just want to see, what the new cutting edge technology is. And so that I spend more time probably on the cutting edge technology end of it than the introductory level, but I've lectured on various different levels depending on where the location was for the program.
Now, are you placing implants too?
Yes, I am.
So you place implant. We'll talk about that. But by the way, I love your website, Boynton Laser Dental, because you're tying in. I mean, when you start a business, you got to have a unique selling proposition. You got to be something. Well, what's different than you? How many dentists are in Florida? What would you guess?
4,000, maybe more.
Yeah, I mean, I think it's double that. I think last I heard, I think there were 8,000 dentists. So you got to have a unique selling proposition, and you work it right into your name, Boynton Laser Dental. I mean, it's just your marketing, it's your image, it's just it really defines you versus the dentist across the street. Because one of the biggest problems in dentistry, I don't think dentists have realized, that is dentistry became so good, it almost commoditized itself. I've had 3 experts on this show that said that when they're starting to, millennials versus senior citizens, like with the millennial, if someone says, oh my God, Susie, her appendix burst and she had to rush to the hospital, they just assume that all hospitals are the same. No one ever talks amongst millennials that, oh, well, which hospital did you go to? Which doctor did you get? Because the doctors got so good, they just assume that if you're removing appendix in an emergency room in a hospital in America, you got to be damn good. Whereas when you study senior citizens, they have seen that they had so much more dentistry done on them. They know that some dentists do root canals better than others, and that this dentist did a lot of root canals, but a lot of the people had to have them retreated by endodontist, et cetera, et cetera. But the millennials, they haven't had a ton of dentistry. They haven't had a bunch of root canals and crowns, and so we're still market differentiation in around the world with baby boomer population, but with millennials, we're really starting to commoditize ourselves. And the one thing that's very neat about what you're doing is, I mean, you work your unique selling proposition right into your name. You're Boynton Laser Dental. And that is such good marketing. I have to applaud you for that. And the worst marketing, the hardest marketing is when you have your name. I mean, if my dental office was called Howard Eugene Farran II, DDS, MAGD, I mean, no one would remember it. No one even know what it meant. But they live in Boynton, and they want to look for a dentist, and you're a laser guy. So it's Boynton Laser Dental. And when you go on your website, you just see laser all over it. As opposed to the fact that you're placing implants, which is huge, but that's not even in your name. But let's switch to implants. How did you get into dental implants, and how do you use a laser with dental implants?
Well, I started... my dentist, when I was a kid, before I went to dental school, was placing blade implants, and he would.
Now you're giving away your age. You're giving away your age. Okay. They don't even know what blades are.
Right. Well, he had done some work with Lenny Linka and those people back in the day. So I was exposed to that, watching him hammering those things in, and then my first job out of my residency program in South Florida was with a gentleman who ran, there's an educational program in Miami called Lindsay Hopkins, and he ran the dental division down there, the implant division. So he was teaching implants down there, and as his associate, I was doing implants in his office in 1985, and just ever since, okay? So we've been doing implants an awful long time. Obviously, things have changed quite a bit, but the basics haven't.
And how are you using a laser in that?
Well, we use the laser for our initial osteotomy. Before we place a drill into the bone, we use it with our soft tissue flap. on occasion, not always. Sometimes we use a scalpel. Once we've done our osteotomy with our burrs, we take the erbium laser and we clean out all the smear layer inside the osteotomy. We open up the marrow spaces in the bone, clean and detoxify that surface, so we've got nice, bleeding bone, and right before the implant gets put in. And then we use the ND-YAG laser to stimulate healing, reduce inflammation and post-op pain after the implant is in place and the flap is sutured back in place. So there's quite a bit of laser involved with that too.
That is really amazing that you just mentioned Leonard Linka, who a lot of people around the world consider him the father of implant dentistry. I mean, that's a lot of people would say that was Brandmark. What are your thoughts about calling Leonard Linka the father of implant dentistry? From my experience personally, and I would say absolutely. He was the first person I ever heard of doing implants, and I mean, obviously they were blades. They're not the type that we're using now, but still, he was in there placing those implants, and I've seen patients in the last 10 years that have those blades still in place and they're functioning. So obviously they had it right at that time. I think he was just an amazing man. I mean, he was so amazing, and I have a RIP thread to him on Dentaltown under implantology. But him and Carl Misch, and I just want to, one lesson of Leonard Linka, I want to remind all you young millennials, when you see something you don't like or understand, is that 30 years ago these guys placing blades and subperiosteals and ramus frames. That when they started doing that, a lot of eyebrows are raised. A lot of them got into a lot of trouble. I know dentists that did 100 full mouth cases with subperiosteals, and when the first one failed, they took his license away, and he lost his source of income and went and got a trailer out in Apache Junction and just drank himself to death out of depression. So, it's dentistry. Most professions have a habit of eating their young. And Leonard Linka, it's really easy to say in 2019 that he could be considered the father of implant dentistry and truly a legend. But when Leonard started doing this stuff back in the day, did he have any controversy? I mean, a lot of people raised a lot of eyebrows in the...
Oh, for sure. Yeah. Absolutely.
Yeah. And so many times, you see something new going on. And so you just, hey, that's not the way we always did it. So you're ready to throw the guy away. And there's so many amazing pioneers in dentistry. And, so just be careful with them. So you're also on the website of Academy of Clinical Technology, ACT, which is at t4med.com. What's t4med.com? What's all that about?
Well, the ACT is the educational arm of Fotona in the United States. So T4Med was, Fotona was originally owned by a Slovenian company, and it was now it's American owned. So before Fotona became an American owned company, T4Med was handling the distribution of the Fotona lasers in the United States. So that's the connection there.
Okay.
So I don't even know if it really still exists, but ACT does exist.
Yeah. Okay.
As the education arm.
And So what implant are you placing?
Right now, I'm using BioHorizons implants.
Okay. There's the largest dental meeting in the world is the IDS meeting in Cologne, Germany, every other year, and it's coming up here in March. And rumor has it there's going to be between 200 and 300 implant companies on display. The kids listening to you on this show, she's 30 years old. She really doesn't want to evaluate 300 dental implants companies. Walk her through why you went with BioHorizon as opposed to the other 400 dental implant companies.
Okay. Well, I mean, for me, the majority of the restorative side is really important as a restorative dentist. If I was a surgeon placing implants and they would walk out the door afterwards and I didn't worry about restoring them, then obviously, how they handle during the surgical portion would be the most important thing. But as a restorative dentist who places my own implants and then restores them, I want them to be, a simple technique for the surgical portion and then easily restored, easy to take scans or impressions. I mean, we're all digital in the office now, so we're scanning. But so it's got to be something that's simple. The components fit well together, and that that our local rep is available at a moment's notice if we ever need a component or something like that. And that's a big difference, because I looked at several other companies who I won't mention where the local reps were not available at all. All right. We've loaned implants to other offices. We've borrowed implants from other offices locally because of, how our rep worked with us. And that's really important to me, is that interaction, and to know that we can, have that flow in the practice. So that's important when you're selecting a product.
I think it's funny how we were talking earlier that that Photona was named after a photon, was from Slovenia, which used to be in the USSR as a military. People don't realize that BioHorizons is in Birmingham, Alabama, and that's another military spaceship. I mean, they were making the solid rocket booster fuels for the space shuttle. But the reason there's so many high-tech scientists in Alabama links back to NASA, and over half of all the NASA missions are military. So so it's kind of like you have a military laser and use a military implant. And in economics we call that a cluster effect. Like if you had an idea for a carburetor, the first thing a PhD economist would say is that if you want to hire someone with 10, 20, 30 years experience in a carburetor, you have to move to the car cluster effect, which would be Detroit. If you're going to launch a movie, you need to go to Hollywood. If you're going to really go far in insurance, banking, and finance, you need to go to Manhattan. And so you have these clusters because, when you're running a business, it's only people, time, and money. And people tend to cluster in an area, and Alabama is a very high-tech area. You talked about scannings, and I can't let you go off that. So she's 25 years old. She's like, okay, I can take an Impergum impression from 3M SB for $17. Why should I buy a $17,000 true definition scanner? So first, what oral scanning system did you use? Did you go with?
We're using the Trios scan, and we're using the wireless, and we've got a laptop on a cart, and it's convenient, easy to use. The quality of the images is really good. It's fast. So our patients love it. So it's partially marketing, just like everything else, and partially ease of use and the ability to email the scans to our laboratory and have the work get started in a much faster time period. We can make modifications online with the laboratory. Excuse me. They can send us a design, through email and that type of thing. So the technology works really well. It makes my life, much easier, and our patients' experience much better too. So it's a combination of all those things together.
Okay, but walk her through the decision. Why you went with 3 Shapes Trios out of Copenhagen, Denmark. Why did you not go with Align Technology, which owns Invisalign and the oral scanner iTero, or 3M's True Definition scanner? What made you pick 3 Shape over Align and 3M?
Well, we didn't want any powder. And I, after using them, I've used the other ones down at at Nova at the dental school. So had some experience, when the days that I was there working in the clinic with the students, and I was just really happy with the scanning and the ergonomics of it and all that, and it just, it works for us. We've got beautiful, scan images, and we can do our shade matching with the system also when necessary. We have complicated shades, so communication with the lab is really important, and it just works. It makes my life less complicated, and whether you're starting your career or more advanced in your career, if it makes things easier and more predictable for you, makes it less stressful on a day-to-day basis too. So that's a beautiful thing.
So it sounds like a big part of that was you wanted to use an intraoral scanner without optical powder as opposed to powder. Talk about that a little more. Why was the optical scanning powder negative for you?
Well, I mean, the patients were not big fans of the powder. Obviously, there's pros and cons to the thickness of the powder, moisture control, things like that. When we have the laser, we can control, any bleeding. We can recontour tissue, which makes scanning or even impressions, much less technique sensitive, and because we're dealing with the moisture issues. But the powder with the moisture and the patients really didn't like it. So that was a big part of it too for us.
Now, in your, am I saying it right? Boynton Beach?
Correct.
Yes. If you're 70% geriatric, are you doing any clear aligners? Or is that really not a big part of your practice?
No, I did a consultation today for clear aligners on a 60-year-old patient. So, either they've had shifting, they may have had ortho done when they were young, and they've got shifting because of, clenching, grinding, whatever, and they want to look better. So irregardless of their age, we've done, we've had patients in ortho up to 80 years old probably over the years.
Yeah, I can vouch this case with you. If you don't believe me on this case, it sounds too good to be true. You can talk to Harry Green, who's an orthodontist in Phoenix, who helped me on the case. But again, when you're young, when you're a millennial and you come out of school, you think the people who want bleaching, bonding, veneers are a bunch of hot 20-year-olds. Well, 20-year-olds are already hot, and they don't have any money. And the number one orthodontic case, I probably did 1,000 ortho cases in 30 years. The number one happiest patient, I can't say her name because HIPAA, but her name's Sue, and she lives in Casa Grande. And Harry Green helped me do the case. And she retired from Michigan, Kalamazoo, Michigan, moved out to Casa Grande. This is back in in the 80s. And I just said to her, she had really crowded teeth. And I said, have you ever considered braces? And she goes, why? She goes, at my age? She goes, I just retired here. I'm 65. I said, well, I'm pretty sure if you're alive, you can still do braces. It doesn't really work once you're dead, but as long as you're alive, I think it works. I did that case, and that was back when I'd only done 4 or 5. So I got stuck. So I had a local orthodontist come by and see her and help me with the case, Harry Green. She was the most, she still talks about it to this day. I mean, this is 31 years later. And she claims it cured her TMJ, but I'm not talking about any of that. I'm talking about the fact that the looks of it. She hated her smile for 65 years. I did braces on her, and she's still giddy about it. And now she's got to be in her 80s. I mean, so just so we all bring to the table our biases. And so young people, like the young millennial dentists, they think the only way you can advertise is on Facebook and Google AdWords. When when you live in a country of 325 million people, I can assure you, factually, statistically, that the number one mailing success in dentistry is still direct mail. And when I say that, I can quote 10 different people who have been on this podcast that have reams of data, some of them that are doing the advertising for DSOs with hundreds of locations, but direct mail is more beneficial than Facebook ads. And from visiting some of the greatest cosmetic dentists on earth, 65-year-old plus women have more money, more appetite for cosmetics, and are more grateful. And the millennials, they don't need it, or they hardly need it. They don't have hardly any money. So again, when you see an 85-year-old woman with a liver spot the size of a golf ball on her head, you just don't sit there and start writing off that she doesn't want younger, prettier, bleaching, Botox, whitening teeth. I mean, and I'll never forget it. My four boys, their great grandmother on both sides, one missed 100 by 4 months. And the other one, I think she missed it by like 9 or 10 months. And I'll never forget when I was a little, taking my boys over there. And when I think I last visited her when she was like 98, and you walked in her bathroom and she had the same makeup layout as my 5 sisters did when they were in high school. And she was in there, and we were going to go out to eat, and she was in there getting primped for 10 minutes. And I mean, and the lady was 90 some years old. I mean, she couldn't even see. And it's just amazing how, what's that?
She still wanted to look good.
Yeah, she still wanted to look good. And I'll tell you how old she is. You might not ever have a patient this old. She was at 90, I think she was 96 when my boy asked her. She said, great grandma, what was the name of your husband again? And he passed away like in his 60s. And she couldn't remember for a second. And she had to ask, oh my God, what was his name? And you might think could you imagine being married to someone for 30 years and you lived so long that you had a hard time to remember? I mean, I have a hard time right now remembering teachers' names that I had in high school. But when I was in college, I could name every teacher I had all the way back to kindergarten. But at 56, right, now I'm having trouble remembering the names of teachers I had in dental school. But man, the money and the beauty and the people willing to pay for all this cosmetic stuff is the senior citizens. By the way, the fastest growing demographics in the United States. Fastest growing demographic in the United States, women over 100. Second fastest, women over 90. Third fastest, women over 80. Women live 5 years longer than men. And I think geriatric dentistry could easily become one of the biggest, most rewarding specialties, and it's not even a specialty yet. On that oral scanner, when you bought the 3-Shape Trios intraoral scanner, does your lab give you a discount if you send in an oral scan versus an Impergum impression, because they don't have to pay a human to pour it up and model and trim it and all that, or not really?
Not really, no. And that was a question that I had when we started too. So, but their answer to me was, well, we've had to invest in all this software technology and milling technology, and that's all, very expensive for them too. So, no, we scanned the patient for a TMJ, orthotic appliance, and I sent it to the lab, and the lab said, well, we have to charge you for a model, because we have to digitally print the model first before we make the appliance. So I was like, well, why do you need that? So there's a whole discussion about that. But no, we don't save any money, But we're not dealing with alloys anymore, so I guess our lab fees are lower because of that too, because most of what we're doing is ceramics.
That is interesting. A lot of the laboratories have said on this podcast that they have far less remakes for the oral scans. In fact, some labs say that their dentists that use them on average will have a 5% remake. That's 1 out of 20. And the oral scan is so much more accurate that it drops it from 5% to 1%. Did you notice a less remakes switching to oral scanners, or not really?
I would say a little bit less, but definitely less occlusal adjustments and contact adjustments. Much less chair side time involved with adjusting once we went digital.
What I liked most about when I got digital scanning is the fact that My gosh, when first time I used it and you saw your prep up on the computer screen, you were embarrassed. You wanted to delete the file and run out of the room and run across the 4-lane road and hope you get hit by a car. I mean, I think the fastest way to increase your quality is the dentist wears loops. You all know that. But then I go in the office and all the wet hands have to wear loops. I mean, when your assistant's making the temporary and she doesn't have loops, your hygienist is doing the cleaning, she doesn't have loops. All wet hands on deck have to have loops. Next would be, so any form of magnification. I don't know a single endodontist who doesn't have a microscope, and they're usually checking before they obturate, and they pull in the scope and they drop it down. They have it mount on the ceiling and they're only looking at 8x, and they all swear by it. And I think the reason oral scanning is so important is because it really helps Sapien when he can see his work at 40x on the computer screen. Is that right? Do you agree with those remarks?
Oh, absolutely. I mean, I use 4.5 loops, and I use a global microscope also for my restorative and perio and endo. So the magnification makes a huge difference in the quality of the dentistry that we do.
Okay, walk through that decision. Why did you buy a microscope global out of St. Louis instead of Zeiss out of Germany?
Well, I mean, I'll preface this. I'm a camera guy, and lenses are very, very important to me. So for my cameras, I use Sony mirrorless full-frame cameras. I use Zeiss lenses or Sony's professional line. But when I tested the microscopes, I had the Zeiss and the global in the office for about 3-4 weeks each. And I personally couldn't see a significant difference in the optics. But the global microscope had a dedicated filter drawer for my laser protective optics, whereas the Zeiss had to be attached on the outside of it. So it was much more cumbersome. So that was the reason. But I couldn't personally see the difference. Plus the global has a lifetime warranty on it. So that was, a couple of the things that guided me in that direction.
Wow. So global was more laser friendly than Zeiss.
Yes.
Wow, that is. I'm actually my only claim to fame is I'm the only dentist who's listened to all of my podcast, and that is I never even thought that. Carl Zeiss is out of and by the way, Americans say Germany. It's not Germany. The whole world calls it Deutschland, including Deutschland. If you're going to IDS, I got to tell you my embarrassing story when I was a young kid going there the first time. I was on a layover in Heathrow in London. I was looking for Cologne, Germany, and I couldn't find it on the no. I was panicking because I only had an hour layover. And finally, I found a pilot, and I said, "How come Cologne, Germany's not on there?" He goes, "Oh my God!" He goes, "American. It's Kuhn." It's Kuhn Deutschland. And I went back there and looked at the deal, and there it was. But only in America do we call Germany, or do we call Germany, or do we call Deutschland Germany? But that is very interesting. Carl Zeiss out of Jena. Is it Jena Deutschland, or just Jena? Do they pronounce a J like the Spanish with the silent? Is it Jena or Jena Deutschland? But that is amazing. So my last question, I can't believe we went over an hour. God, we went 10 minutes over an hour. Thank you so much. My last question is this. You lecture to the students at Nova. I lecture to the students in my backyard. And what advice would you give? I want you to finish with this. Your daughter just walked out of Nova. She's got $400,000 in student loans. She just got her diploma. And she said, "Dad, give me some advice." What would you tell her?
Well, she completed school already. All right. She's walking out the door. And she's not coming to work with you.
Right.
My son graduated from Nova about 2.5 years ago, and he's in the practice here with us now. And he's also an adjunct at Nova at the same time. So basically just learn as much as you can. Expand the knowledge that you were given in dental school, because you're not done. Even 35 years out of dental school, I'm still learning every single day. And that's the best advice that I can give is don't think you know everything, because none of us ever does. and just keep learning and keep absorbing and stay open-minded. That would be the best advice I could give.
Yeah, because I think at the year 2019, none of us are going to live long enough before the science is all in on dentistry. It'll always be an art and a science in our lifetime because we all know what we know, but we don't know what we don't know. And dentistry is a very humbling experience because I think it's far. I think you have to come out of school and practice 5 years before you're humbled enough to realize that the amount we don't know in dentistry probably is greater than the amount we know in dentistry. We're only 5,000 years after the pyramids. I've always kind of thought that dentistry is probably at the 50-yard line. I mean that science at the 50-yard lines. I bet it's going to be another 5,000 years before they just understand all math, physics, chemistry, biology, and dentistry. Do you think it's that far away, or do you think it's closer?
You know what? We don't know. Things change. I mean, some things that 20 years ago we thought were an absolute, we're finding out that they're not. We're finding about the connection between periodontal disease and dementias and Alzheimer's now. Whereas, 20, 30 years ago, whoever would have thought about those things. So I think it's going to be a constant learning experience. I don't think there's ever going to be an end point as far as education and knowledge is concerned. It's just going to keep going because, like I said, some of the things that we take for granted now, 20 years from now, they may not be, the end-all explanation to things.
Oh, yeah, so, and I'll just give one final example. They were, I remember when we were in school, they taught by PhD. People who had PhDs in physics and chemistry would say that an atom was 99.99% empty space. And now they say, except for dark matter, and now now that atom is denser. And in fact, I couldn't believe I read an article the other day. I was reading one this weekend, and in one article it was talking about how Einstein said you couldn't go faster than the speed of light. And this is by a guy with a PhD, right? That you can't go faster than the speed of light. And in the same article, he's talking about how the universe is expanding faster than the speed of light. So these galaxies are falling off the horizon because the galaxy is expanding faster than the speed of light. So every amount of time, we're going to see less and less galaxies because they're moving away from us faster than the speed of light. And I'm like, dude, you just said you can't go faster than the speed of light. And now you're saying the galaxy, the universe, is expanding faster than the speed of light. I mean, to read in that one paragraph, you can't go faster than the speed of light, and the universe is expanding faster than the speed of light. It's like, hello? I mean, so all these absolutes aren't always going to be absolutes. The first four elements were what? Earth, wind, fire, and water. And now they've found 93 different ones on Earth. Hey, Harvey, seriously, I know you're a busy dentist. I know you see 10 to 15 patients a day. I know this is what you did at the end of the day. I'm so honored and privileged that at the end of a long, hard working day, you decided you'd come on my show and talk to my homies for an hour. And I cannot tell you how grateful I am. Thank you so much for coming on the show.
And I appreciate your time and speaking with you this evening, too. It was a pleasure.
And you know who I want to follow up on you still? Let's get my buddy Keith Bateman, KGB, and the president of Photon, Jeff Jones. Send them an email. Tell them that I want to get them on the show. And also Mark Colonna on using lasers in endodontics.
Yep. I'll send him an email this evening.
All right, buddy. And tell your son he's got a big shoes to follow. I hope he does well doing that.
He's doing a great job. Thank you.
All right. Have a great day.